My name is Paul Nguyen. I am a family physician here at Inside Urgent Care. I am the owner and manager of Inside Urgent Care. We're physician-owned and operated, so we have physicians here. We don't have mid-levels. We open earlier, we close later. So it's a big convenience for patients.
My main goal is, and I think every nurse's and MA's goal is to make sure our providers are happy and satisfied with the patient care that we give out.
We want to be the urgent care to go to provide quality care, to have affordable, efficient, evidence-based care for our patients.
The most important part is making sure that the patients are well taken care of and we meet their needs.
The wait time is always quick. The turnaround time is quick, and our patients are very satisfied. They love the environment here.
The onboarding process with the other vendor was a bit tedious. After each session, I was more confused. And my partner, who has been using Experity for years, said, hey, why don't we give them a try? So I looked into Experity. I mean, it took him like a week to really sit down and do the training with the EMR and even the front office side, the PM. So it was easy for the staff to switch, and we wanted an EMR that wasn't confusing, that if I had issues that it could be resolved fairly easily and quickly. And with Experity, we found that. We use Experity's RCM to help us with billing our patients. Having somebody in-house, you'd have to pay them a salary, but having it outsourced, it takes a bit of pressure off of me in managing the urgent care. So I think that was an easy choice. Because Experity is so easy to use, our staff, our MAs are cross-trained to do front office as well as back office. They can check in patients and within 10 minutes, get patients back and out the door.
The registration process is very easy. It makes it super easy for the patients to register online. If they're at home, they can register online real quick. So once they come in, we just do the whole payment process and get them to the back quick and easy.
We have a couple of patients come in. They might be on the elderly side where they don't know technology, and it's simple for them. Once they see how easy it is and we can walk them through it, then they'll pick up and they're like, oh, okay, this is easy,
It's also very user-friendly and very great to get, to use when it comes to putting in medications and ordering labs or medications, putting in vaccines, putting in everything is just very user-friendly.
It's less paperwork, meaning most of it is electronically. Even the HIPAA consent forms, the consent to treat, those are all electronically through the system with Experity versus Athena and Epic.
Our door-to-door time, it's gone down from like 70 minutes per patient down to about around the 50-minute range. And of course, our goal is to get below 45. So we're still working on that, but you can see like with Experity, it's helped a whole lot. With Experity, it's, hey, this is exactly what I need. This is how my workflow, this is how the patient checks in, this is labs are ordered, how they're discharged, and it just flows and they're in and out the door.
I've been doing this for 20 years. I've dealt with like a lot of EMR systems. Experity is one of the ones that I can truly say it was so simple, efficient, and there's no way you can make mistakes. It's just so smooth.
I personally love Experity. It's very great. It's very easy, like I said, to maneuver around and get used to.
I've had 2 instances where colleagues have asked about what EMR to go with, and hands down, I first thing out of my mouth was Experity. It's just easy. If you're in an urgent care, if you're opening up an urgent care, it's just a no-brainer to go with Experity.